Hello. This is a presentation on the concept of death and dying related to child health concepts. So first we're going to talk about factors that influence loss, grief, and coping ability. And we'll go through each of the developmental stages and how those individuals experience death and grief and coping. So with infants and toddlers, they have little to no concept of death because they are so young. So they will typically mirror their caregivers or their parents' emotions. So if their caregivers are sad or angry or depressed, the infants or toddlers will match that emotion. They'll react due to changes of illness or being in the hospital. So the changes in their routine, any painful procedures, separation anxiety, the thought of having less independence, they'll react to those things. And then possibly they'll have regressions to earlier stages of behavior or development during this time. So preschool children typically have egocentric thinking, which means they think more about things happening to them than to other people, or that they're able to cause something to happen. So magical thinking. So if they feel like the thought of death can be caused by them thinking about death, this can cause guilt and shame. Sometimes they'll view separation from their caregivers as a form of punishment. And then dying is thought of as temporary by them because of they don't have any concept of time. So that's preschool children. School-age children, they're starting to understand and have more of an adult concept of death. They understand and respond to logical and factual explanations. They're starting to have a fear of illness, death, and the unknown because they know that it is not temporary. And the loss of control also scares them. Sometimes this fear is shown through behavioral issues. And school-age children also become more curious about death, funeral services, and what happens to the body after death. Adolescents have an adult-like concept of death, so they understand death as an adult would. They have difficulty accepting it because they have established an identity during this time. They're starting to figure out who they are, and they don't want to die. They rely more on their peers than the influence of their parents, but at the same time, they have a hard time relating to their peers just because of what they're experiencing, and sometimes they have difficulty communicating with their parents. They become increasingly stressed by changes in physical appearance caused by their illness or medications that they're taking, and they can experience guilt and shame. So let's talk about a child life specialist. This is something that's not listed in your ATI book, but I thought that it was important to mention here just because you may see this during clinical rotations. But what a child life specialist does is they focus on the psychosocial needs of children. They work closely with the social workers and chaplains as well as other healthcare workers. And they work in conjunction with them to help the child cope with medical experiences. So things that they may do with the child is therapeutic play. They'll educate the child in a way that reduces fear and anxiety. And then they are skilled in preparing them for procedures. So these healthcare workers typically have a bachelor's or even a master's in child life studies or any related field. So this is a very specialized role, especially in the hospital on a unit that cares for children that are dying. Having this team member is very helpful because they really understand those concepts that we just talked about on the previous slide, and how the children, based on what developmental stage they're in, how they understand death and how they deal with death. And so they take that knowledge and really help put the child at ease during this time. So just quickly, and this is right out of your ATI book, Physical Manifestations of Death, and this is not just for children, but for any human. Sensation of heat, even if the body feels cool. They have decreased sensations in their body. Sometimes they have difficulty moving their extremities. Loss of senses, confusion, loss of consciousness. They may have a decreased appetite or thirst. They have swallowing difficulties. They lose control of their bowel and bladder. They'll have low heart rate, low blood pressure. They may experience the Cheyne-Stokes respirations. And then those pulmonary secretions will start to pull in the base of their lungs or in their throat. And they may have what's called the death rattle. So when they breathe, you'll hear almost like they're gurgling. So palliative care. This is a very special type of nurse that cares for dying individuals or dying clients, but especially in children. One thing to remember with palliative care, just like in an adult or an older adult that's dying, you want to include the family in the plan of care, but especially in children, including the entire family, including the parents, any siblings, grandparents, making sure everybody's involved in that care. You want to provide a home-like environment. So if the child's unable to be at home, like on home hospice, if they're in the hospital, you want to make it as comfortable for them as possible. Make it feel like they're at home. You want to respect any cultural or religious preferences. Clarify information and explanations. During times of high stress like this, you may feel like you've explained something 5 times, but sometimes they're so distraught over what's happening, they're just not understanding. So clarifying that information and explanations, they may ask the same questions over and over again, that's okay. Encourage physical contact. So encourage them to talk about their feelings, encourage them to hug, to touch. Physical contact with a dying person is very comforting for both individuals. Provide comfort measures. So make sure the room is warm, make sure they have blankets, the pillows are comfortable, just make sure it's a comfortable environment for everybody. Mouth and oral care, making sure that they're adequately hydrated, or if they're able to eat, that they're eating. So you don't want to limit nutrition or hydration during this time. You want to make them comfortable. And you want to control their pain, most of the time with regular scheduled medications. So we don't want to wait until they're in pain to give them pain medicine, because you're always playing chase, and so a lot of times these patients will have scheduled pain medications. And then you want to encourage distractions to help manage pain as well. So anything that you can do to take their mind off the pain that they're experiencing. And then lastly, don't forget to care for yourself too. So as nurses, we experience a lot of difficult things in the hospital, and death and dying is one of them, especially with children. So if you're a nurse that's caring for dying clients, make sure that you take self-care measures. So take time off from work when you need it, express your feelings to a support person, maintain contact with the families of the dying client if you feel like that will help, and attend funeral services if you feel like that will be helpful. A lot of times we try to conceal or bury our feelings, and so develop your ability to have empathy and know that it's okay to have those feelings. So just remember, we have to care for ourselves too when we're caring for clients in difficult situations.